Stay tuned for everything you ever wanted to know about ringing in the ears. First of all, how do you pronounce it? Tinnitus or tinnitus. It's a little like tomato. The layman's term is tinnitus, while most professionals will call it tinnitus. As an audiologist, I've heard it all, but some of the incorrect pronunciations include tinnitus, tendinitis, or tetanitis. Now that that's cleared up, what is it? The definition of tinnitus is any sound that you hear inside your head that does not have a cause or stimulus from outside your head. Most commonly, it'll sound like ringing, and people often refer to tinnitus as ringing in the ears. It can also sound like buzzing, hissing, roaring, pulsing, chirping, whooshing, whistling, or clicking. Most people have experienced short episodes of tinnitus. This is quite common and not a big deal. But for many people, tinnitus is constant, whether or not it is considered bothersome to them. A lot of times, it is not noticeable during the day while there is other noise around, but it will be more noticeable in quiet or when people are trying to fall asleep. Tinnitus is typically a symptom or a side effect of something, but in itself is not a disease or condition. If there's no indication of someone's history of why they have tinnitus, they could see a physician like an ear, nose, and throat specialist to rule out a larger problem of which tinnitus is a symptom. However, most cases do not have medical causes and are best treated by audiologists. Audiologists have either master's degrees or doctorate degrees in how to diagnose and treat hearing and balance disorders. Over 50 million Americans have tinnitus to some degree. That equates to over 15% of the population. Of those, 20 million people struggle with bothersome tinnitus. The people who consider themselves to have bothersome tinnitus are typically in the age range of 20 to 60 years old. Roughly 2 million Americans have extreme, debilitating tinnitus that disrupts their daily lives in a significant way. For the people with either bothersome or debilitating tinnitus, they may describe it as affecting sleep, concentration, mood, work, and overall quality of life. Once those groups with bothersome or debilitated tinnitus are accounted for, it leaves 30 million Americans who say they have non-bothersome tinnitus. Typically, tinnitus is related to some degree of hearing damage, whether or not that is resulting in hearing loss yet. It may show up immediately following an acoustic trauma like a gunshot without wearing hearing protection, or another traumatic event like a car accident, or it could show up years after damage to the hearing organ is done. It could be temporary, like if you have to take a high aspirin dose for a period of time, or it can be permanent. Tinnitus is most common in older populations because of the likelihood that they've been around potentially noisy environments or have experienced the other factors that can cause or contribute to tinnitus over their lifetime. Sometimes it can be difficult to distinguish what can cause tinnitus versus what can contribute to it or exacerbate it. Potential causes of tinnitus are hearing loss or damage to the hearing organ, whether or not that's resulted in actual hearing loss, loud noise exposure, ear disease, such as one called Meniere's disease, migraines, head or neck injuries, certain types of tumors on the nerve pathways to the brain called an acoustic neuroma, drugs or medications, for example, too much aspirin or quinine, anemia, diabetes, and hypertension. Common triggers or things that greatly exacerbate tinnitus include sodium, stress or anxiety, including straining to hear, wax or other objects in the ear, caffeine, smoking cigarettes, alcohol, lack of sleep, and temporomandibular joint disorder or TMJ. In order to understand why tinnitus can happen, it can be important to learn a little about how we hear. In a normal hearing ear, sound starts out outside our head and gets funneled into our auditory canals to our eardrums. The eardrums vibrate like when hitting a real drum, and they send the sound through the chain of bones called ossicles. You see the names on the slide calling the ossicles the malleus, incus, and stapes, but you may have learned them in school as the mallet, anvil, and stirrup. When those bones vibrate, they send the vibration into the cochlea, which is a snail-shaped object. In fact, cochlea is Latin for snail. The cochlea is filled with fluid that creates motion when the vibration hits it. That movement of fluid brushes over the tops of teeny tiny cilia or hair cells that line the length of the cochlea like piano keys. But instead of 88 keys like there are on a piano, there are 30,000 hair cells that may be stimulated by that fluid movement. When those hair cells are stimulated, they send the stimulation through the auditory nerve that is near the vestibular nerve to the brain. The brain receives that whole signal and makes sense of it for you. The most common cause of issues with hearing is damage to the hair cells in the hearing organ. They are very delicate, microscopic parts that can easily be susceptible to damage due to noise, age, medications, lack of oxygen from smoking, or diabetes. This is a microscopic view of the inside of the cochlea. It shows that there are 3 rows of what we call outer hair cells that are the most sensitive to how we pick up on sound. In the second image, you can see that the rows of hair cells have been decimated. Some of the little bundles are intact, but there are a lot that are missing or broken. The bottom image shows a view from the side where the hairs that are supposed to be standing up tall are falling over or breaking off. In general, the hair cells in our hearing organs are so delicate and sensitive to damage that it doesn't take much to harm them. The result of damaged hair cells can be hearing loss, tinnitus, or often both. So does tinnitus cause hearing loss, or does hearing loss cause tinnitus? Often people with tinnitus say that they can't perform well on a hearing test because their tinnitus interferes with the test. To the patient, it appears that the sound in their ears covers up other sounds in the environment, causing them to miss speech or other noises. While that could be true if we are testing a certain pitch with a sound that's very similar to the sound in their ears, tinnitus usually does not cause someone to perform poorly on a hearing test. Audiologists can change the sounds that we present so they don't interfere or get masked accidentally by the tinnitus sound. But we often expect to see hearing loss because tinnitus and hearing loss go hand in hand. Also, as we discussed earlier, stress or strain can exacerbate tinnitus. When there is hearing loss present, it can cause the listener to have to work harder to hear, which results in stressing or straining to hear. That in itself can make the tinnitus louder or more noticeable. That can be quite the negative cycle. So to answer the question, tinnitus does not cause hearing loss, but hearing loss can cause tinnitus. What do you do if you start experiencing tinnitus? If something recently changed in your medical history, like a new medication or a diagnosis of a new condition, you should bring it up with your primary care physician. Discuss those changes in your medical history and request a diagnostic evaluation with an audiologist. Beware if your physician or anyone else tells you to get used to it or that nothing can be done. That kind of negative counseling can often cause the brain to fixate on the tinnitus, now with a feeling of helplessness that nothing will ever help. That is the exact opposite of what we want to do with tinnitus treatment. If you're aware of some decline in hearing, you have a significant history of noise exposure, or you just develop tinnitus slowly over time, it is appropriate to start with an audiologist. The audiologist will do a comprehensive case history and hearing evaluation. He or she may also have you fill out a questionnaire asking specific questions about how the tinnitus affects your daily life, as well as your mental and emotional well-being. Often, how bothersome the tinnitus is in the ear of the beholder. It is a very subjective basis on how you are aware of it and how much it draws your attention to it throughout the day. Once the audiologist has evaluated you, he or she will likely do one of 3 things. Determine that there could be a medical issue that is worth ruling out and send you to an ear, nose, and throat specialist for further evaluation. Recommend treatment for the hearing loss, or recommend treatment for the tinnitus. In many cases, the pitch or sound of the tinnitus is in a range where there is significant damage to the hearing organ or cochlea. The brain is waiting for input from the ears across the range of pitches, but it might not get it. At the same time, the damaged hair cells are trying to do their job by sending the signal to the brain, even if they're too damaged to pick up actual sounds. The result is that the hair cells that are damaged send signals to the brain as if a sound is present when it really isn't. The brain receives the signal of the sound that does not have an outside source. That is why often the sound of the tinnitus is a high-pitched sound, because that's where the majority of the damage is, and those are the hair cells that are going to send the phantom signals to the brain. The hair cells want to contribute and do their jobs, even if they're too damaged to do it perfectly. The result is that they will send the frequencies of sounds they're responsible for, even if there's no outside source of that sound. There's a similarity to when someone has a limb amputated. The brain receives feeling or pain from a limb that is no longer there. The pathways from that limb are still sending the signals to the brain, even when that limb is missing. Tinnitus is like a candle in a dark room. If I light a candle and turn out the lights, we would have a hard time looking at anything but the light from the candle. When hearing loss is present, it is like that candle in a dark room. No other sound is getting to the brain except the sound created in the ear. It is hard to hear anything but the sound of the tinnitus. When the light is turned on, the candle flame is still visible, but in comparison is now much dimmer. When we treat hearing loss with hearing aids, it's like turning the lights on. We reintroduce the brain to all the sound that's been missing, and often the tinnitus fades into the background. Hearing aids can help tinnitus by restoring those missing sounds to the brain, creating a natural masking effect. The hair cells that are damaged can now receive the real sounds from the outside world with the help of amplification from the hearing aids, so your brain is able to perceive real sound instead of those phantom sounds. In fact, hearing aids are currently the only thing on the market that do more than a placebo effect. It is worth saying that hearing aids should be fit by a professional who can ensure that the hearing aids are set appropriately to the hearing loss, enabling the patient to hear the full range of what they're missing. Simply amplifying all sounds, as some amplifier products do, is not enough. Properly fit hearing aids should be measured while they're in the ears of the patient to verify that he or she is hearing to their best ability. These days, hearing aids also have built-in calming or masking features. One of the key issues with tinnitus is that it gets tied to the emotions, and it can create or exacerbate anxiety. Some hearing aids have calming music or other sounds to reduce the anxiety associated with tinnitus, so the mind can focus on other things instead of the frustration of hearing tinnitus. Another popular feature in hearing aids that can greatly help people with tinnitus is Bluetooth streaming. Many hearing aids can now be paired to an iPhone or other smartphone, allowing sounds from the phones to be streamed into the hearing devices. One of the most popular uses for this feature is to stream phone calls, but it can also be used to stream music, podcasts, radio or TV programs from the phone directly into the hearing aids. There have been many apps developed that create calming or masking sounds to help people with tinnitus. The beauty of Bluetooth compatibility in hearing aids is now you can stream directly from the hearing aids into your ears at any time, day or night. Believe it or not, our primary goal of tinnitus management is not necessarily to mask the tinnitus until it's not noticeable at all. The first goal is to help manage the emotional response to the tinnitus. Long story short, tinnitus can become tied to the emotional center in our brain called the limbic system. Our limbic system can quickly associate very negative feelings to that tinnitus. This can happen specifically if the tinnitus began under traumatic circumstances, such as a car accident, or if we subconsciously assign fear to it because we think it's the symptom of something worse. For example, let's say you were in a car accident and the airbag went off in your face. It resulted in tinnitus and possibly some hearing loss as well. Your system of emotions, or limbic system, drew an association between the tinnitus and getting hit in the face with an airbag. Now every time you become aware of the tinnitus, it reminds you how scary that accident was, and it makes your perception of that tinnitus worse. Or, as another example, if the tinnitus came out of nowhere, but you heard about a friend who developed tinnitus before they were diagnosed with a brain tumor, your limbic system may associate the tinnitus with a sign that you have a brain tumor, creating a lot of anxiety every time you hear it. In those cases, the first goal is going to be to remove the negative emotional response to the tinnitus. The other main goal is to create room for something called habituation. The definition of habituation is the diminishing of a physiological or emotional response to a frequently repeated stimulus. That basically means some new source of sound will draw your attention, but as you keep hearing it over and over, you will get used to it to the point where you hardly notice it. Here's an example. When a family moves near train tracks, at first the train may wake them up at night and draw their attention every time it goes by. However, if you talk to people who live near train tracks, they will say they got used to it to the point that it doesn't wake them up or even make them aware of when it goes by. That is habituation. Unfortunately, when those people have visitors for short periods of time who don't have the benefit of habituation, they may get woken up by that train every night. When tinnitus first begins, it is a new sound that the brain will draw special attention to. Over time, habituation will happen because the sound becomes something the brain is used to being there, so it can start to fade into the background. If there are negative emotional associations to the sound, habituation may take longer or may not happen, which is why it's so important to identify how the tinnitus causes that person to feel. Habituation is a natural process, which is why many people with tinnitus are not bothered by their tinnitus. If you ask them if they hear it, they'll say yes after they think about it. It's kind of like when you or I have to think about if we hear our computer hum or a refrigerator drone. Once you think about it, you realize it's there, but if you're not thinking about it, you hardly notice it. Sound therapy for tinnitus has a goal of making the tinnitus be softened or masked to a level where the brain can habituate. For people who have tinnitus that is persistent and bothersome, there have been a lot of different behavioral and sound therapies developed, such as cognitive behavioral therapy, masking and sound generators, progressive tinnitus intervention, tinnitus retraining therapy, cognitive habituation tinnitus treatment, and biofeedback for stress reduction. A multidisciplinary team approach may be used, including an audiologist, psychologist or psychiatrist, otologist, and auditory neuroscientist. That team of people may prescribe medications to help with anxiety or depression that can result from tinnitus. Recently also, there's been an interest in using CBD as a calming agent to help reduce stress and potentially help people sleep better, especially when their sleep is disrupted by the tinnitus. However, there are no pharmaceutical medications specifically approved by the FDA for tinnitus, and it is definitely worth noting that the over-the-counter or made-for-TV supplements that are advertised do not help tinnitus and are likely a waste of your money. I like to say that if there is some newfangled treatment or cure for tinnitus, all audiologists would know about it, me included. It's worth noting that tinnitus symptoms have been on the rise during this past year of COVID-19 lockdowns and quarantines for many reasons. If you have tinnitus, have you found yourself saying, "I've lived with tinnitus for years, but recently it's been more bothersome"? The journal called Frontiers in Public Health published an article in November of 2020 that indicated some startling findings about how COVID isolations affected people's tinnitus. They found that 34% of people with tinnitus reported a worsening of that tinnitus throughout the pandemic shutdowns. Why would that be? The study found increased levels of anxiety, depression, and irritability from the pandemic, and since stress and anxiety can be some of the most significant triggers, it likely worsened tinnitus for that group. It also found 58% of those surveyed reported an increase in loneliness. Of those who reported increased loneliness, the majority also reported increased tinnitus. Some of the key strategies for getting your mind off your tinnitus is being distracted with other people, work, or activities, which was not as possible to do while observing the distancing, lockdowns, or quarantines. Also, tinnitus tends to fade into the background when there are lots of other sounds around, but if you're isolating in your home where it's quiet, there may not be as many natural sounds in the background to help you habituate to the tinnitus. It wasn't just the people who were affected by COVID-19 shutdowns who experienced increased tinnitus, however. The same study by Frontiers in Public Health published that 58% of people who reportedly actually had COVID also reported that COVID exacerbated their tinnitus. The reasons behind this are unknown at this point, as are a lot of factors about this mysterious virus. There are sure to be many more studies and articles published that may bring enlightenment to this subject. As you have seen, tinnitus is a very complex and nuanced topic and is different for each individual. If you are aware of tinnitus in any form, I would encourage you to start with a visit to an audiologist. Good hearing isn't just important as a way to reduce the awareness of tinnitus, but also for good cognitive health. But that's another story. If you'd like to reach out to us for more information, our phone number and website are on the screen. Here's to happy hearing. Want to schedule an appointment online? Grab your smartphone and open your camera. You can scan the QR code here and it'll take you directly to our website where you can schedule online.